to Well Within Reach, and today we have with us Saif Chowdhury, who is a fourth year medical student at Temple University. And he's been doing something which I think is really great. He's been coming to Frazier Family Coalition for Stroke Education and Prevention, gathered a group of medical students together, and they did a six-series Follow Your Gut, talking about gut health. And we just wanted to talk with him about what inspired him to get that group together. What are some of his findings since he's been reaching out to people? So, soon to be Dr. Chaudhry, soon to be uh, fourth year medical student. So I'll pass the mic to you, and let you tell us about how you created this whole idea, and what
Yeah,
you find.
sure. Sure, yeah. So, I mean, the series we called it Following Your Gut Feeling, and the whole point of this series was to try and put together a health lecture series on digestive health that would be applicable to the North Philly patient population and make GI health information approachable, practical, community focused, especially for seniors, but really for anybody because gut health is so interconnected to all of our other bodily systems, whether it's heart health, brain health, skin health. And so it's something that people neglect a lot, but a lot of people have problems with. So making that information approachable was really the goal of putting this series together. Um, and I guess the findings, what we kind of figured out from all this is that people really do want to learn about gut health. I remember the first lecture that we did, it was on heartburn. People were so excited to talk about their own experiences with heartburn and how common it is and how frequent it is and how they have questions if they don't know where to go or who to talk to. And so that made the series that much more rewarding. It was able to connect, that academic medicine to the community with the Temple Health GI department, having its role as well. So it was, I think, really fruitful and helpful for the community, I hope. Yeah.
So, how did you convince your fellow colleagues to get together and do this?
Oh, I mean, convincing is, I don't think it's, exclusive to Temple Medical School specifically, but I think any med school you go to, the medical students genuinely want to, you know, teach patients and have face-to-face interactions with, the people that they're going to be taking care of in the future. So it didn't really take that much convincing. As soon as I told them there was this opportunity, so many medical students tried to jump on board and teach one of the lectures, and there were only six of them. Everyone was asking if there's going to be another one, when the next one's going to be, if we're going to do another one. I still get questions today if we're going to start the series up again. So I really didn't have to convince anybody. It was more so like, how do I like filter through everybody to try and get, pick six, or it ended up being two per lecture. So picking 12 people to lead the series. So yeah, everyone had a great time. And yeah, everyone was really excited to do it.
Yeah. So, what I observed, just from watching and listening, one of the things that I thought was interesting is the amount of questions that people had. People had so many questions about gut health that it seemed like they never really had an opportunity to talk about it. So you
Yeah.
guys sort of gave them a platform to talk about gut health. So what did you talked about heartburn? Were there other common symptoms that people were experiencing that seemed?
Yeah, I mean, heartburn was, I think, the most frequently asked about, like throughout all the lectures from when I spoke to other medical students and asked about how it went for them. But I think another big one that I think a lot of people also are scared of, it might not be the most common, but it definitely the most scary, I think, is colorectal cancer.
Mm,
And one thing that we stressed, if anyone's listening to this podcast, something that we stressed in all of our lectures is if you see blood in the toilet for whatever reason, that's a red flag. That's an indicator that you should be going to see a doctor. You should be definitely going to see a doctor if you see blood in your poop, right? Because GI bleeding, it could be a bunch of things, um, but that could be a sign of cancer. But hopefully it's not. there's a lot of other things that can cause GI bleeding, any inflammatory bowel pathology. But that was what people had a lot of questions about as well, especially because in the North Philly population, there is an increased prevalence of colorectal cancer as well. And it's one of those things that you can catch early and really prevent, right? That's why we have, colonoscopies, and that's why we have screening guidelines for trying to prevent colorectal cancer. And so, yeah, that's something that a lot of people had questions about, and we were really happy to answer them. And I think that's why lecture series like this are so important to try and do and to try and educate people. So, yeah.
I think the other part of what you guys did that I thought was really great is that you gave practical steps for people to improve their gut health. So you want to talk a little bit about that?
Yeah, I think the main thing that we talked about that is, I think, most easily attainable for a lot of folks at home is trying to get more fiber in your diet. I
Mm-hmm.
think that goes a long way in terms of taking care of your gut, is making sure that whatever you're eating, whatever you pick up at the grocery store, make sure there's fiber in there, and be mindful of how much water you're drinking as well, because fiber won't do much unless you're hydrating yourself as well. So drink lots of water, make sure to get a lot of fiber in, make sure to move your body, because when you move your body, then your gut will also respond and move as well. Um, and sorry. And so yeah, I think those are the most actionable steps you can take. Fiber. Everyone needs more fiber in their diet.
Sounds good to me. So, yes, we want you to come back to the Frazier Family Coalition, and
Yeah,
yes,
I'd
we
love
want you
to.
to do more of these talks because they're so critically important so that people can, be more on the preventative side if possible. I think
Exactly.
you also encourage quite a lot of people to get their colonoscopy as well. So that was major. So I just want to thank you for your hard work in putting this together, for, just organizing it with your fellow medical students, organizing the topics, and really picking topics that we thought the community really, wanted to listen to and hear about. So we invite you to come back, talk more about the work that you're doing in this area, and I'm going to let you have the final say about, anything you want to say about what you've done, what you plan on doing, or any last words you want to leave us about gut health.
Okay, sure. Well, well, before I say anything, I also want to thank everyone at the Frazier Family Coalition and you, Dr. White, as well, because you really helped us, set up everything. You gave us a venue to do all this, and even with the topics, when we're going over structure of the curriculum, you really helped out with, what would be the most applicable for the population, what people want to listen to. And, there were lunch learn series, so people were eating healthy food while we were, so it was just a great setup. Everything was great. So hopefully if we do this again, it'll be the same kind of setup. And everyone, it was beneficial for the people listening and also the people giving the talk. All the medical students loved being a part of it and had a lot of fun. So yeah, what I'll say is, I guess, look out for another lecture series. Hopefully we can do this again in the summer or in the coming years. We're also talking with a few other venues to have similar lecture series in the area. So Zion Baptist Church, they're thinking of having a similar lecture series with the same kind of format. So I guess look out for that as well. In terms of gut health, yeah, just make sure to follow up with your doctor, your PCP. If you have constipation or diarrhea, keep a log of your bowel movements because that makes everything a lot easier for everybody. Eat a lot of fiber, drink a lot of water, move your body, get a lot of sleep, all those things.
All right. I like that. So if you're having any additional workshops, any series, please let us know. We can certainly help advertise and spread the word about the work that you're
Mhm.
doing. Again, I just want to thank you for being here today. I know you're busy. I know you're studying and doing all those things. So we appreciate you taking time out for us today.
Yeah, of course. Thanks for inviting me.